I think first it's important to just note upfront that South Africa public sector is not yet rolling out HIV self-testing. While we actually support it in terms of policies, but the public sector is not yet rolling out. In the private sector, however, there is some self-test kits that are actually available. So I'll go into deeper details with regards to both sectors. This is the current situation as of 2015 in South Africa, epidemiology. An estimated 7 million people were living with HIV in South Africa. Our population is about 52 million. And prevalence is sitting at 19.2%, and adults on antiretrovirals is about 48%, and we have 380,000 new infections, just under 1% incidence. So where are we with regards to the first 90, or rather 90 in general? This here slide supports actually the first slides that I showed you, and we see that if we're looking at the first 90, with 100% of people that are estimated to be living with HIV, 74% actually know their status. And I will focus mainly on the first 90. However, just for a few seconds, just to say 52% are on treatment. And out of the 52% on treatment, 32% have taken viral loads and 26% is virally suppressed. Current approach to the first 90. South Africa revised the HTS policy, the national HTS policy in 2016, in alignment to the 2015 WHO guidelines for HTS. And it embraces the full range of services, including the 5 Cs, as well as test shifting, which actually was approved by the minister in 2010 when we first pulled out our HTS policy. Now, all our lay personnel are trained, and lay counsellors are able to conduct rapid testing in public health facilities and in communities. Quality assurance is also quite emphasized, especially for the delivery of correct results. And while we revised our HTS policy for 2016, we also revised our testing algorithm and validated them for correct diagnosis. We have ongoing training and mentoring to support quality assurance. We've actually rolled out IQC in all public health facilities, and we are rolling out in community testing. We have also started rolling out proficiency testing, and we are still in the process of rolling out RTQII to ensure quality of testing. We have introduced targeting in terms of testing to increase yield or to maximize yield. And while we may be aware that South Africa tests about 10 million people a year, we also, just like Zimbabwe, if it's business as usual, we may not necessarily be able to reach those that actually need to be reached to get to the first 90. So we have introduced targeted testing in terms of population and regions, and we're using data to inform that. Our testing modalities for HTS, we still use facility-based, client-initiated counseling and testing. We are also using provider-initiated counseling and testing, and when it comes to community-based, we still use our standalones, we use our mobile, particularly to reach those hard-to-reach communities. We do testing in the workplace, especially when we talk about those that do not really go to facilities. We're talking about the farm workers, the miners, construction workers who are not necessarily able to go to facilities for different reasons. And again, we do a lot of mobile testing in higher institutions, and we have introduced home-based testing. Right, so HIV self-testing has been identified to have potential benefits to assist the country to reach that first 90. It has the potential impact to increase the access and acceptability for those that are under-tested and those test-averse populations. And we're talking about serodiscordant couples, men, adolescents, female sex workers, MSM, people who inject drugs, and so on. And again, as we said, HIV self-testing has that potential approach to scale up HTS in general to assist us in closing that gap of testing in South Africa, particularly for the populations already tested. And in terms of our profile of the product that we will be using, again, we're looking for high-quality manufacturing products. I think Cheryl made a good presentation in terms of that. We need them to be appropriate for an untrained and a non-professional layperson, acceptable analytical performance in the lab, quality assurance, and high sensitivity. I think it's important to note that because it is a screening test, not necessarily providing definitive diagnosis. And for those communities that may not necessarily be of high, in terms of education, we need them to have pictures so that they're able to follow the instruction leaflet. Fewer steps, it needs to be simple, it needs to be easily interpreted, first time to results, it needs to be stable, because we know that some of our community members or testers may want to actually see that stability without it changing over a short period of time. And again, we are also recommending that it should include referrals, and we also have a national HIV and AIDS helpline, which is what we are hoping to use for those clients that may need assistance in terms of pre or post-test counseling, or how to use the test kit, in addition to the public health facilities. So in terms of how we are going to approach implementation, it will really depend on the target populations. However, we have testing really run on the backbone of public health facilities, hospitals, and now again in the public sector, as I said, pharmacies are now selling HIV test kits. Workplace programs are also another approach that we may use, and special services within the public health facilities, and this will be considered for both assisted and unassisted testing. In terms of the policy environment, we're guided by WHO internationally, the HTS guidelines of 2015, as well as the self-testing guidelines. Nationally, we have actually captured self-testing in our HTS, the National Revised HTS policy, in our consolidated treatment guidelines. We are working with the South African Clinician Society on finalizing the guideline for implementation, as well as in our national strategic plan. This is the framework that was actually launched in 2012. However, we may be aware that we'll be launching our new NSP for 2017 to 2022 on the 31st, and self-testing is captured there as well. I've already talked to this. So in terms of addressing policy, addressing implementation, as well as addressing regulatory, it's very important that we have a regulatory body to actually manage what is already happening in the country at the moment. In 2015, the South African Pharmacy Council actually approved the selling of self-test kits over the counter in pharmacies. This resulted in an influx of different test kits into the market that are unregulated and that we may not necessarily be able to validate the quality assurance. And then in 2016, following several discussions, again, the council published a notice for public opinion to actually now talk to the minimum standards for the selling of the test kits. So at least this provides some kind of guidance in terms of the how. And the department and other sectors have actually made inputs to this, and hopefully it will be published because the deadline was now in end of March. So we'll see how this continues. And while we are not necessarily rolling out in the public sector, we have ongoing demonstration projects throughout the country to inform eventual implementation, and these cover feasibility, acceptability, usability, how we target different populations, distribution and waste disposal, etc. And as a Department of Health, we've been working with WRHI, with WHO, our country office, the South African Clinician Society, the National Institute for Communicable Diseases, which is our reference lab, and it assists us with the quality assurance recommendations in the lab. So again, we are waiting patiently for pre-qualification, WHO, and this will inform implementation in the public sector. And as I said, there are already different kits available in the market. Again, we are hoping, and we are already trying to engage the South African Health Product Regulatory Authority, SAPRA, as well as the South African Pharmacy Council, to assist us in working together to try and regulate what is in the country at the moment and what will come in at a later stage, because lack of regulation has led to different test kits that are now found in South Africa. Some are even branded. We see that we have branded ones. These you find mostly at the airport, but as we said, this can lead to those challenges where we are unable to ensure the regulation as well as the quality of the kits. As I've said, we have demonstration projects, and these are informed by these kind of questions. Who should we access? Should we roll out to everyone? Should we target? And as we know, we have planned to do targeted implementation, priority groups, adolescents, young people, age of consent. Our age of consent in the country is 12 years at the moment. Should we use the same for self-testing as well? How and where should we distribute, as well as the cost? In public sector, obviously it will be free, but how will the private sector subsidize to ensure that people are able to use? And these are just some findings for studies that have been done, that acceptability and feasibility is relatively high for HIV self-testing. These are small, again, studies on usability, on acceptability, specificity, as well as, again, acceptability in different population groups, particularly in key populations. We see the MSM, truck drivers, sex workers, and young girls. WRHI is working on the STAR program, again, that is working towards conducting usability and assessments to fast-track implementation in the country, and they're mostly working on usability projects. We have another team in Cape Town, Desmond Tutu Foundation, the Linda Gale Becker, and et al., who are working on self-testing in young people, adolescents. And South Africa is also planning to participate in the phase 2 of the PSI Unit 8 project, and that will also give us guidance in terms of how to move forward in terms of HIV self-testing. And in terms of what's coming, conclusion and way forward, we are fast-tracking finalization of the minimum standards to regulate currently available test kits, working with the South African Pharmacy Council and with SAPRA. We are trying to finalize implementation with our WRHI, the Clinician Society, as well as our country office and NICD. And we're finalizing the demo projects, waiting to get the results of those, awaiting pre-qualification from WHO, and again, ongoing implementation in terms of targeting the population that need to be targeted with regards to self-testing. And finally, I would like to acknowledge everyone who was involved in the presentation and in self-testing in South Africa. Thank you.